Welcome to the Dogtor Bros, where we have an honest discussion around vet life in and out of the clinic. My name is Chris, and I'm your doc of the day and your guide through this episode. I'm a veterinarian in Winston-Salem, North Carolina, and I'm here with my closest friends from vet school.
Hi, this is Brandon. I'm a internal medicine practicing veterinarian in Fort Collins, Colorado.
And this is Adam. I am a relief veterinarian in Louisville, Kentucky.
And this is Chris again. In today's episode, we're going to be talking about CKD or chronic kidney disease, and kind of go through the different nuances and how it's diagnosed, clinical signs, some labs that we would see, and then how we would manage it. Referring a lot to our internal medicine specialist, Brandon. So, Adam, how do you typically see this present in GP?
Yeah, so typically when I have patients come in that I suspect chronic kidney disease or any kind of kidney disease, I mean, you'll hear the classic of they're drinking more than normal, they're peeing more than normal, they're acting lethargic, they're not really eating. Sometimes on presentation, especially in cats, you can tell they're pretty dehydrated. Sometimes they'll be, have light mucous membranes, and you're worried about them being anemic as well. So, and it's kind of a broad range because, I mean, some of them, if they're early, maybe they're just drinking more than normal and otherwise acting fine. But other ones, if it's more advanced and the owner caught it later or it developed more quickly, they could be in a much more severe state. So it's kind of a broad range, but those are kind of the general clinical signs that I see on the initial presentation.
I would agree. I mean, that's kind of how I see it too. I know cats, I see it a whole lot in small dogs. For some reason, I don't see it a whole lot in bigger dogs. At least that's in my area. We have one dog I know that we're managing with chronic kidney disease, but I typically see it in our smaller dogs and cats. Do you see anything different, Brandon, at all? Or is that kind of what you're seeing? Or
No, that's pretty classic. I will say that sometimes it's even more subtle. Like sometimes owners aren't picking up on overt PUPD or polyuria or polydipsia. And it's more of we catch some labs that have a very slight increase in their kidney values, in particular the creatinine. There's BUN and creatinine. And then they get a urine sample, and then that urine is dilute. So that's kind of like one of the initial screening tests. But the tricky thing with chronic kidney disease specifically is you can't really call it chronic kidney disease until you've got a spectrum of labs over the course of 3 months, because there's a lot of things that can cause acute kidney injury or acute kidney disease, and it can be tricky to differentiate. So I feel like a lot of my job when that's caught and someone refers it to me is to try and differentiate, is there more of an acute problem? Is this a chronic problem? Or is it kind of a combination where the animal had a chronic problem that was flying under the radar and an acute issue exacerbated it?
yeah, and I feel like for me, it seems almost like it's more of it's probably been a chronic issue that's now just been an acute problem, but it's been going probably for years. But they're like, yeah, it's the first time it's been to the vet in 2 or 3 years, and now we're finally doing blood work on it. And they're like, oh yeah, let's run some urine as well because the blood work doesn't look too great, or vice versa. We'll say we'll run the urine first, and they're like, it's not a UTI going on, but it's got low specific gravity. Let's run some blood work because now we're worried about kidney disease. And sometimes you kind of have to twist their arm to do it because hey, this could be something more serious. At least how it is in my experience sometimes. So we kind of touched on it. So typical blood work is what I say I always run on it, and then also doing a urinalysis. Anything else you say to do for initial workup there, Brandon?
Yeah, I think you guys, if you catch a patient that has some of the clinical signs and you do your just basic complete blood count, serum chemistry, urinalysis, you're doing pretty good to start. And then the things that I would kind of encourage as a kind of standard thing to do is once you get the elevated kidney values, just making sure that you have a good history, which I'm sure you guys are doing, but any sort of toxins that the animal could have gotten into, kind of trying to help rule out things like a toxic injury, for dogs, like grapes or raisins or antifreeze or what have you. And then just trying to um, do initial supportive therapy if the animal's like significantly ill, like getting some fluids on board. And a lot of times, I guess you guys would be maybe, if you're really worried, you'll be running in-house blood work. If it's kind of a subtle thing, you'll probably send it out to get like more bang for their buck. Um, and the thing that I think would be really helpful to do for a lot of these cases, just right off the bat, is to get a blood pressure. And that is something that I feel like, generally speaking, we don't do as well. I didn't do it very much when I was a GP, even with cases that I was suspicious of initially. But as a kind of a screening test and management of the kidney disease down the road, blood pressure is extremely important.
That's good to know too, because I know I don't do it as probably as much as I should. And I'm like, oh yeah, we probably should get some blood pressure on this cat or dog, depending on what it is. And what is I know because we don't have a Doppler, we use just the cuff that we have for our surgery vet. But what is the preferred method to get it?
Yeah, good question. Doppler is my preferred method. So like if you don't have one, I encourage you guys to get one and train your techs on them, and just practice on healthy animals as like just a way to learn. Um, it's not perfect because animals get stressed when they come to the clinic. That will play into their blood pressure being elevated. But there are some general parameters to where if it's over a certain threshold, then that might be a problem. And oftentimes we're not going to be treating high blood pressure right off the bat. We're going to be catching it. If it's mild, we're just make sure we check it again in like a couple of weeks or so. And if it's persistent and the animal is not significantly stressed, then it's probably significant. There's a whole set of like a whole consensus statement on hypertension, systemic hypertension. Kidney disease is probably the most common cause of systemic hypertension in dogs and cats, whereas like in people it's like diabetes, but we don't really see like a diabetic hypertensive disorder as much in dogs, maybe in cats, but not so much dogs. And the big reason that blood pressure is important is kidney disease can cause high blood pressure. High blood pressure could worsen kidney disease, and it's like a vicious cycle. So we want to do what we can to get it under control to minimize progression. Because as we all know, kidney disease is pretty much like a non-reversible thing once it's considered chronic. Acute kidney injury, yeah, there's some recovery. Chronic kidney disease, our goal essentially is to minimize further damage down the road.
That makes sense. And what would be your go-to medication for kidney disease and hypertension?
Yeah, so like if it's like specifically for hypertension, the options now, you can go with just a more traditional ACE inhibitor, so like benazepril or enalapril. Nowadays, most folks are leaning towards what we call angiotensin receptor blockers, which work similarly. The big benefit of those that they're starting to find in some of the research is there's some actually positive or kind of beneficial angiotensin receptors that are hit in if you block the like if you actually block the converting enzyme, which is what the ACE inhibitor does, some of those minor benefits are gone. Whereas the angiotensin receptor blocker is very specific for the ones that cause hypertension. So that's what a lot of people are going for now.
Good to know. Getting chronic kidney disease, I know you said you need to have like 3 months of data. When do you start treating, or do you do any supplements or get them on a diet early on? Like when would be your kind of threshold? It's like, hey, we can start treating this versus, hey, we're just monitoring at this point.
Yeah, I think the big thing, like your big goal is to rule out any sort of acute kidney injury or something that's causing an acute on chronic kidney disease. So typically when you're doing that workup, like you guys already said, you do your blood work, you get your urine, you're looking for evidence of bacteria in the urine. If you find that, you culture it. If you see other signs of infection, you look for those as well. You look for protein in the urine. And on that note, really quick, like as far as classification of kidney disease, it's the kidney value, in particular the creatinine. You can also grab an SDMA to kind of correlate. I don't like rely on SDMA, but it is something that can be helpful and jump up your diagnosis to like a different stage. And then the sub stages are both going to be protein loss in the urine as well as blood pressure. So getting blood pressure under control, minimizing protein loss in the urine, all of those things in combination are going to help minimize further progression as best as we can. As far as supplements and diets, it really depends. Supplements, the easiest one to recommend is omega-3 fatty acids. There's data out there that it helps minimize the oxidative damage in the kidneys and can protect some of those cells. So I always recommend it because it's a really easy thing to do. Just put them on them and they're good to go essentially. And that's all over the counter. But there are some like, veterinary branded type ones that I tend to recommend just because I know that where they're sourcing them. And then as far as diet, it also depends because, like a lot of folks think, okay, kidney disease, they got to go on a diet to minimize things like phosphorus intake and other stuff. It's not always the like right thing to do right off the bat. If it's pretty early, like stage 1, you don't necessarily need to switch their diet yet. So there's guidelines, the International Renal Interest Society, or IRIS, who essentially have developed guidelines for both staging as well as treatment guidelines. It's a free resource. I can even link it whenever we post this episode for any vets that may or may not be familiar. They actually just came out with a nice little like cheat sheet shortcut for all the things that help you stage and kind of what you need to look for. And then they have a longer document that has like stage 1, like you do these things. Stage 2, you do what you did in stage 1 and add this. So it's pretty straightforward. It takes time, which is not the strength of being in GP practice. I know you guys know that firsthand nowadays. You don't have like what I have. I have time to dive into some cases and like read long records and go back and look at years of data. But I know you guys, it's more complicated. But if you guys do look at that resource and you start seeing some of these cases more and more, I think I totally think that any GP can manage the majority of chronic kidney disease cases.
And that kind of leads me into the next thing is when would you say we need to refer them to you guys? Because it's out of our wheelhouse type of thing. Is it more just when, we just don't have time to read it all, or we see a case and we just, it's not for us? What would you say is the best time?
I think oftentimes what happens is some management is started and things progress a little bit, or like maybe a blood pressure can't get under control, or there's protein loss that's persistent, and like the GP's like, I don't want to keep messing around. I'd rather you guys go to a specialist and get some more workup done. Part of the other like standard workup for kidney disease is looking at it with advanced imaging, typically ultrasound, because you can get a good look at the medulla and the cortex and see what kind of, normally there's nice, pretty distinction between the two. With chronic kidney disease, that distinction is blurred with some of the fibrosis that occurs in the kidneys. The kidney size can shrink, especially in cats. So all of that stuff we look at on ultrasound and can be pretty important for the diagnostic workup, especially if we're not seeing other things, as well as like obstructive kidney disease. Sometimes like an animal really doesn't have chronic kidney disease. It looks like they do, and they're getting worse, but they have some sort of upper obstruction in the upper urinary tract, like at the level of the ureter or somewhere else that's just not visible without that kind of imaging. So as far as like you guys, how often are you guys referring out specifically cases that are like chronic kidney disease is the primary problem?
This is Adam. So definitely when I see those more advanced, clinically advanced cases where they are doing pretty poorly and values are pretty significantly elevated, I usually refer, if nothing else, just for hospitalization. The clinic I'm at is not ideal for hospitalization. We don't hospitalize hardly anything there. we typically do refer out hospitalizations. Um, so typically with those, we'll recommend referral for hospitalization and further follow up. The biggest downside is that the area we're in is a lower income area. So we kind of have to do what we can with what the client either can or is willing to do. And most of the time that comes to like some outpatient management. Typically with that, the biggest things I do is start them on the food, and then we'll do like either like a daily sub-Q fluid or every other day fluid, something like that. If they can do them at home, we'll kind of show them how to do them at home if they're comfortable with that. Some people would rather come back and have it done in the clinic daily. So we'll kind of cater to whatever's best for them, and then I'll kind of recheck those values every couple of days just to kind of see if we're trending in the right direction. So I think that's the biggest struggle that I have is again, being in the lower income area, is that a lot of people aren't capable to go to a referral, and so then I have to manage that from more of an outpatient point of view. And so, if you have any tips or tricks on what else I need to be doing for that, let me know.
Yeah. Real quick before we get on that track, like Chris, how often are you referring stuff?
Probably not a whole lot. Again, it depends on, look, we'll offer it and then it's like, no, just, I want to manage it here. So I'd say maybe, again, I think it's about once a year-ish, they'll actually take me up on it. Or most of the times I'll get is them to go do an outpatient ultrasound at least. That way we can kind of get imaging and see if there's anything else that we're missing. And then we'll come back and manage it from there. But yeah, it's not super often. The majority of the time it's outpatient, like Adam's saying, and we're having people come in for sub-Q fluids. We start them on diets. I haven't had great success with diets a lot of the times. When I try to start them on a diet, they're just so picky about it that they don't want it. So I was like, just let them eat whatever at this point. So that's typically on the higher stage of kidney disease. Another supplement we always have done, I'm going to start doing this omega-3 fatty acids, but we've done Azadil. I don't know if you've been associated or heard of that at all, but it's a probiotic. We tell people that, hey, you can give them the capsule or open it up and sprinkle it onto the food or a small meal, but it's supposed to be on an empty stomach is best. But I've seen good results with Azadil. I don't know if it's like the best thing in the world, but I've done that sometimes. I've had better success with that versus doing the diet.
I have used Azadil some as well. And then there's another one that's specific for cats. I think Dogtor makes it, called Porous One. So yeah, I didn't know if you knew anything about those, because I have seen those used and I've used them myself a couple times. But again, it's one of those things that it's tough to really know the efficacy or how much that's helping in the grand scheme of things.
Yeah, I think like the idea is it helps with the uremia a little bit. Like the way I see it when it comes to some of these supplements, like it's not that they're not helping; they're just not helping as much as I would like them to. Because the whole point of the kidney diet is it's a couple of things. It's to help minimize some of the secondary effects of the inability to appropriately excrete and absorb certain electrolytes. So in particular, phosphorus. These diets are typically lower in phosphorus because the kidneys are not able to appropriately excrete phosphorus and manage that calcium phosphorus kind of homeostasis that occurs in the kidneys, or as part of the kidneys are a big part of that. As well as minimizing protein, which the way I tell, you have to be careful with clients because sometimes they're like, oh, this is like a low protein diet. They're like, well, I don't want my pet to lose a bunch of weight. It's it's really not low protein. It's kind of the minimum level of protein that your pet needs to maintain healthy muscle. Because a lot of diets, they're a little bit higher in protein. That protein gets broken down, turns into things like BUN and creatinine after they're processed. And then that's what causes those kidney values to get elevated. So I don't know if some of these probiotics are changing the way in which certain things are absorbed, and that minimizes some of the byproducts of some of the proteins. I don't know off the top of my head. I think my main thing is if the kidney values are high enough, you should minimize protein content. We should get the phosphorus level as low as we can. And those things should help minimize the side effects like decreased appetite, lethargy, all that stuff. As far as hydration, it's a big consequence of the disease. I think of kidney disease in two ways. I think of it as like a numbers game, and then I kind of just think of it as like a quality of life game, because every animal is different. I've had plenty of dogs and cats that have pretty, you'd think like on paper, wow, those kidney values are super high, and they're actually like clinically okay. Like they've either adapted to it or like they still have a good appetite or whatever. And then as far as the numbers game side of things, like your kidney values are a surrogate for how many functional units of the kidney are left. So as we generally know, like you're not going to even see any signs of elevated kidney values until about like 3/4 of the kidney is already not doing its job, just because they're so efficient. The SDMA, the big like kind of thing about SDMA is, in theory, or the data shows, I should say, really, the data shows that like 2/3 of kidney function is when we start picking up those SDMA levels increasing. So you technically catch things a little earlier, and maybe even a little bit before some of that, like urinary concentration is changing or decreasing. But at the end of the day, like your hydration is dependent on the kidney's ability to filter out water and filter out all those byproducts. And when you only have so many nephrons working, they just need a lot of water to push through those remaining ones that are left. So when it comes to these cases like you guys are talking about, if I had to guess, their creatinine's probably like 4, 5, 6 or whatever. Oftentimes hydration is the most important thing, which is difficult to do with sub-Q fluids. And then with appetite, like your goal is really just to support them as best as you can. So I do things like anti-nausea medications like Cerenia and ondansetron long-term. Like I'm not opposed to them eating not like non-kidney diets, or at least giving them some toppers to help them eat because they need to eat. The most effective way to maintain hydration and appetite when they're in that stage and none of the supportive care stuff is working is really to place a feeding tube. And that's oftentimes a stopping point for many owners. They can actually be managed well with a dedicated owner, and it sounds more intensive than maybe it really is, but the feeding tubes that I typically have placed are going to be an esophageal feeding tube where you have to anesthetize the animal, which in itself can harm the kidneys. So you have to like warn the owners about that. You're going to anesthetize them. You're going to, make an incision. After what I typically do is use a large pair of like Carmalts and go through the mouth, get nice and far away from all the vessels towards the dorsal part of the neck, push up, just make a small incision on that spot, let your forceps pop through. And then you can they have like dedicated feeding tubes now. You can just pull that through, put it into the esophagus. I did like make sure you measure beforehand, generally speaking, and then you take an X-ray since it's already opaque, and you can just see where that thing is. And it should be like the distal 2/3 to 3/4 of the esophagus. And as long as you suture it in, just make it nice and clean, and then you have to train the owner to just like check it every day and make sure it's clean. Usually this is a good thing for cats because they're not going to be like dogs and roughhousing and all that stuff as much, generally speaking. But you have to have the right animal for it. And that thing can stay in for months. And essentially what you train the owners to do is just give them water through it so many times a day, rather than the sub-Qs. It goes straight through their GI, they absorb it. You can give them a liquid diet through that. That way they're getting their nutrients without having to worry about like forcing themselves to eat food. Obviously, in a smaller animal, you can only do so much volume at once. So you're going to be having an owner that has to do this multiple times a day throughout the day. Like usually my owners break it up 3 to 4 times a day. And then a larger animal, like a large dog, you can do this too, but you're talking large volumes of fluid. And that's like a long time pushing stuff through a syringe into this tube. But I've had patients manage that way. Typically at that point, it's more of a month's game. But if that's like the only limiting factor and the owners are like, hey, like if I can just support my pet through this and make sure that they're hydrated and they'll take this food, then it's like a viable option. There are like all the other factors that you guys know, though, like if the animal's, lethargic, seems painful, has like other side effects, maybe their blood pressure is extreme and it's been difficult to manage or so on and so forth because of the kidney disease. That might be a conversation to stop. But I think those would be those advanced, like that esophageal feeding tube. Like those are the more quote unquote advanced options that people would send us to or send patients to us for to like give those options and place those.
Yeah, this is Chris. That makes sense to do it that way. I mean, I've placed feeding tubes before, but I've thrown that out, I think, for one owner recently about it for kidney disease. Actually, no, it was for a liver issues. The liver values like need to go get it feeding quickly. But yeah, no, that's I didn't realize I could stay in for that long of a period of time.
Yeah. And like, there's always risk of like local infection. Like if the tube moves, like the owners need to come in and get it checked because there are some major complications that can occur with that, in particular pneumonia. So like the owners, as long as you educate the owners and just let them know what we're doing and just inform them through the process, like it is definitely something that's worthwhile. So yeah, I would say like that's something that a lot of GPs don't think about on a day-to-day basis. I will say, just as far as like general case management, like getting your baseline lab work is like the key thing. And if you guys are just screening animals, like my favorite thing is if we have an animal and they're worried about kidney disease and they refer to us, they've been going to their vet since they were like 2 years old or 1 year old, and they have annual blood work from like years back. I'm like, fantastic. Like I can kind of gauge maybe where some of this started, and I can maybe even gauge like, oh, maybe there was an incident that happened that caused an acute kidney injury that resulted in chronic kidney disease.
That makes sense, which also makes it awesome why we should be pushing for yearly blood work.
Yeah, you're just trying to provide the best care.
Exactly. And then also, I know you mentioned Cerenia long term. I've done this in the past, is compounded Cerenia for owners that can't pill cats, and then they'll do it transdermally, and it's had good success with it. I don't know, what have you seen with that?
I've never used like compounded or like even transdermal Cerenia. Typically, if we're at a point where the cat can't take it, I'm usually recommending a feeding tube, because then at that point you can just put it through that.
That makes sense. I think that's actually another option to do versus someone who doesn't want to get it compounded or wants to try something a little more aggressive. But yeah, at least I don't know when's the last time I've actually used it, but we've used it in the past where we just gave a local pharmacy some Cerenia. I think we gave them like the 160 milligrams, so they had a higher concentration. They compounded it for us and they made a transdermal gel, and they would use that instead of pilling the cat, and the cat would not be as nauseous and would eat. I don't know the efficacy of how well it was actually working, but it worked well enough to actually get the cat to eat, and the owners were ecstatic about it.
Yeah. And the other thing I do too is ondansetron or Zofran, like the pill is so much smaller. So it's a lot easier to give to cats. And like, it depends on the cat. Like if you're giving it because the cat's nauseous because it's not eating, like giving it a pill pocket is usually not viable. But if you have an owner that can maybe pill just something smaller, that would be a really good option.
No, that's good to know. So I feel like we've kind of hit everything on here. Is there anything that you would change, Adam, on how you would manage these things?
I think the biggest thing that was brought up that Brandon went over is blood pressures. That's something I don't do, really. Haven't typically done. I don't believe at the clinic I'm at the most that they even have a blood pressure machine or a Doppler or anything. I mean, they have the cuffs for the surgery, but yeah, I think that's the biggest thing is checking blood pressures and trying to keep an eye on that, while you're managing these kidney cases.
No, for sure. Yeah, and I agree. I think I need to be more on top of doing the blood pressures. And then also I like the omega-3 fatty acids. I'm going to add that into my repertoire of things to use as well.
Yeah, and this is Brandon again. I'll add in a few other little things that we just probably don't have time to talk about in more detail at the moment, but we could always revisit this if you guys wanted to like talk about it in more detail. With protein loss, that's usually a dog problem. So, I mean, definitely check for it in all your patients, and you'll want to do like a urine protein creatinine ratio if you have a patient with protein like loss in the urine, especially if their urine is dilute. And just making sure that if you catch it once, I'd ideally catch it again. Not everyone's going to pay for that test multiple times, but if you're pretty confident that they're losing a significant amount of protein, which technically would be like greater than 0.5 for a UPC, but especially like greater than 2 for a UPC, those animals are typically at risk of like a thromboembolic event from that protein loss. The idea is for proteins, there's antithrombin 3. That's a big kind of protein that manages or prevents clots from forming in the body, and if they're losing like measurable protein through their kidneys, they are most certainly losing that in the urine as well. We don't measure it directly typically, but you can start them on a medication to prevent like a inappropriate clot. So like prevent like a stroke or prevent like a pulmonary thromboembolism. And typically we're going to be doing clopidogrel for that. So if I have a dog that has significant protein loss and we've checked it, especially like multiple times, I'm typically recommending that to owners. And that's not a benign drug. It can cause like, if the dogs are like roughhousing, they can cause bruising and other stuff. So you have to be careful. But better to have them be careful than to come in with a stroke or something else. If there's evidence that they're at risk. The other thing that I'll mention is electrolyte supplementation can be tricky. Sometimes they are or are not losing a significant amount of certain things like potassium. So if you're doing your routine blood work, you're monitoring the potassium's dropping, especially in something like a cat, you can always supplement with just like something like Renal K Plus. It's just like a gel. And then phosphorus reduction. We talked about that briefly with diet. You can add in aluminum hydroxide to help with that. And you'd be surprised, like even with like stage 2 kidney disease, you want to keep that phosphorus like low end of normal low. So if their phosphorus is even within the reference interval at like 5.5, and they're stage 2, that's technically still too high, and you should add in phosphorus reduction. But those guidelines that I mentioned have all that in there. They have the recommended parameters and that kind of stuff. Lastly, for cats in particular, anemia. Anemia can definitely occur since the kidneys are a big stimulus for producing erythropoietin. And when there's enough fibrosis and loss of function of the kidneys, they're not producing that as much, doesn't stimulate the bone marrow, and then their red blood cells start to drop. So oftentimes cats, once they, start getting in like the 20-ish range for their red blood cell count, and it's persistent, and we know that they have kidney disease, I typically will recommend giving them something like darbepoetin. And there's actually some new drugs on the market that have different ways of fighting this, but we can maybe talk about that at a later time.
This is Chris, yeah, for sure. And I think that can be for CKD part 2 when we go into more depth of everything. Well, I forgot to do the intro question, so we're going to do a fun outro question for today. What is everyone's Super Bowl pick?
This is Brandon. I'm kind of biased here, but if the Broncos can be a dark horse, we'll see if they can beat the Chiefs later this season and keep going on a winning streak. Then I might have them heading that way. In reality, it's probably going to be the Chiefs, but it is what it is.
Yeah, that's what I was going to say. Probably the Chiefs. I mean, your best odds are just saying the Chiefs, I guess. But they somehow find a way to win, even when they're bad. I don't know. I'm a Bears fan. It'll never happen, but it'd be cool.
Mm-hmm.
Yeah, I keep waiting for Baltimore to make it there because I know Lamar, like, he works hard, and he's a good all around athlete. So I keep waiting for them to break through. They haven't yet, but maybe this is their year. Who knows?
I agree with you guys, and I'm a Dolphins fan, and we still did terrible with Tua coming back today. But I would say probably the Chiefs. I think, like you're saying, Baltimore could potentially make a comeback, or not come back, but like make it a run with them because you have Derrick Henry now, and they look good. They just need to be consistent. So I would say the Ravens, but also the Lions.
I was going to add, I should really say anybody in the NFC North, because besides the Bears, except for the Bears, because the NFC North has been absolutely killing it this year. The one year the Bears decided to be halfway decent, every other team in the division was like, we're going to superpower times 10. So the Lions have been killing it, and really the Vikings too. Both of them have been on a roll.
Mm-hmm.
Yeah, the Bills too. I was going to say,
yeah, the Bills
have always been on the cusp.
That's right.
Every year, I'm kind of like watching them just not quite make it. So I know they're still really good this year.
Yeah, they're kind of like the Ravens in that category. Like they're good enough to like make it. They just haven't seemed to get over that hump.
Yeah,
but yeah, I think we can talk about this for forever too if we wanted to. Thank you once again for joining us on the Dogtor Bros.
If you would like to support us, please share this episode with others who may be interested in today's topic, and leave us a 5-star review on Apple Podcasts, Spotify, or wherever you listen to your podcasts.
Would you like to influence our next episode? We love hearing your opinions and thoughts. Your comments may be our next topic.
Please leave us suggestions via email at thedoctorbros@gmail.com, DM us at thedoctorbros on Instagram, or leave us comments on our posts. Again, this is Brandon. You can reach me at drmasonIM on Instagram.
And this is Chris, and you can reach me on Instagram at dr.chrishernandez.
And this is Jeff. You can find me on TikTok or Instagram at DermDrJeff, DermDogtorJeff.
And this is Adam. You can reach me on Instagram at DrAdamDVM. That's DrAdamDVM.